Good afternoon. This is the Native Strong Town Hall with Dr. Lyle Ignace of the Gerald L. Ignace Indian Health Center. Welcome back again. We are here continuing to bring the message or updates regarding the COVID-19 pandemic to the Native community. And thank you again for joining us. For those who have been here before, we love questions. Bring your questions, the more the merrier. If you're jumping in via Zoom, there's a little chat bubble at the bottom of your screen. You can hover over that, drop in a comment or a question there, and we'll get to it towards the end of the session here. If you're joining us via Facebook Live, you can just drop in a comment on our Facebook page there, and we will answer those as well as we get into it a little later. Just want to mention quick, I know Dr. Ignace will hit on this later, but we are having a Native Community Vaccine Clinic June 22nd. If you want to register for a vaccine, if you're Native, you're a Native member of a Native household, give us a call, 383-9526, 414-383-9526. And again, Dr. Ignace will talk more about that as we go in here. And also our good friend Mark Denning, who has been busy, I believe, coaching the past couple of weeks. He'll be joining us a little later in the show today, right around 3:30. So again, thank you all for joining us, whichever way you are here with us today. And I will pass the baton over to Dr. Lyle Ignace. And thanks again for being here with us, Dr. Ignace.
All right, thanks, Jeremiah. Appreciate it. And yeah, Mark is he's teaching some Native youth lacrosse, and so he's gonna always hard to get them kids together. It's like herding cats, and so I'm sure he'll be on shortly. So as Jeremiah was talking, we have another vaccine event coming up, and this is a very specific event for the Native community. June 22nd, and that's the first dose. Second dose will be July 13th. So the reason why this is so important is we're really, and I feel that this is probably a sentiment from a lot of people, that the COVID-19 pandemic seems to be kind of reaching its end. We hear all kinds of good things about fewer infections, fewer hospitalizations, fewer fatalities. These are all great things. However, we still know that our younger population, specifically in our Native community, how important this is. We know how important it is for adults. We've been talking about this for almost 8 months straight here about the vaccines and its effectiveness, not only for older individuals with chronic care conditions, how effective it is for them, but as the age groups keep going down in age, we are seeing the efficacy of the vaccines work just as good across the board for everyone. Now that everyone in the country has had an opportunity to get a vaccine, Pfizer has come out with an amendment to their emergency use authorization to authorize the ages of 12 and older. So school is, for most people in the state of Wisconsin, ending today. And looking ahead, schools are already looking ahead for the next upcoming year. They've been talking about this for weeks, and what do we do? Is this still going on? How do we approach this? And so with summer comes with a lot more activities, social events, gatherings, families, get-togethers, sports, outdoor, indoor, just a lot more activities are starting to open up. This is all great. This is all, important to know. But what we also know is that our younger generation, the 20s, as well as our adolescents, their rates of vaccinations have not been as high as the older age groups. And so right now, and I'll go through these numbers as I've been talking about numbers week after week, is that these younger age groups are going to become more and more important. And the reason why I say that is the older generations have gotten their vaccine. These are the people in these age groups that are not getting infected. The ones that are the younger generation. And this is what continues to propagate this virus throughout communities. And as a result, if it's continued to allow to transmit within communities or within families, the individuals that have not been vaccinated are going to be the most susceptible, and obviously the ones more likely to transmit and continue this this pandemic further on. So now that school is going to be ending, this may be the perfect opportunity for families to think about their kids. And what will also be interesting, as well as Pfizer is also going to be finishing up on their most latest clinical trial, and that's going to be the 5-year-olds, 5 to 11-year-olds. So we could be hearing quite soon, within a month, what's going to happen with that younger generation, the 5 to 11-year-olds, and how does that look moving forward going into the school year. So, and I know right now, universities, colleges, they're already mandating that kids returning back to higher ed schools are already mandating students if they're coming back, they have to be vaccinated. So that's a whole story in itself, but that's what schools, colleges, universities, that's where we're heading. Already some of the more prominent schools, Ivy League schools, are already stating that. And so this, over the next 2.5 months, are going to be kind of critical for our Native population, because we have kids that are going to college. We have, people who are going to be returning for the next school year. And what does that look like? Are we just going to do more of the same? Are we doing at home? Are we doing in phase? Well, this opportunity for not just now, but also looking towards the future, is getting our youth vaccinated. And so this may be the first of 2 vaccine campaigns coming this summer, and it will be specifically to vaccinate our younger generation. This event, 12 and older, 12 years of age and older, Native event, Native eligibility, either by tribal ID or proof of descendancy. The vaccine that we'll be offering is Pfizer. There will be offerings. There'll be free food boxes, personal hygiene items, cleaning products, items for little ones, diapers, drawings for prizes, gift certificates. We have sponsors that'll be present. Wade Fernandez, music by him will be there. So this is really a great opportunity now that we're heading into summer. What does summer look like? Well, it may look like the effort of getting our families vaccinated. So this is really a perfect time to do that. So one of the major headlines that is going on right now is the Delta variant. What is the Delta variant, and what is this all about? And so what we know about this is that the Delta variant, and I'll go through this probably next week. There's nomenclature, terminology changes that are occurring that are going to change everything that we talk about. What I have been just a different set of terms that everyone will need to be caught up in. So, but what is a Delta variant? Well, this is the variant of India that was going through that country, and that's the B.1.617. Now, what's interesting is that that they called this the double mutant variation because there were two mutations occurring pretty close together on this virus. It's kind of a bad name, but I guess in real time, no one was really sure what to call this. So it didn't necessarily mean that it was more worrisome or more contagious or more virulent, but the nomenclature, does do it injustice. So how this came about was the B.1.17, B.1.617 variant jumped from one person to another. And in this process in India, it changed slightly. And what we're seeing now is that one of these variants had been dropped. So we had two variants along the sequence. And as this was propagating through India, one of the mutations was dropped. And then we had the B.1.617.2 now being called Delta. There's alpha, beta, gamma, there's all kinds of other terminologies being used right now, but this was the original Indian variant, developed into a double variant, and then dropped one and is now called B.1.617.2, otherwise known as Delta. So is Delta more dangerous? Well, what is known is that it is just as transmittable as any of the other variants, such as another term, alpha. Alpha was the UK variant, that was the B.1.17. That is still the same alpha. That was kind of the original variant. It is just as transmittable as the UK variant. So Delta, equivalent to alpha. The Indian variant, transmittable just as much as the UK variant, pretty much the same. Now, when it comes to the vaccine efficacy, what they're noticing is there's a significant drop with Pfizer after the first shot. So with the UK or the alpha, that first shot actually still had a very high efficacy rate. This is with the UK variant. And only after the second shot, where it showed, even demonstrated a much higher, not the full Pfizer, 95, 96%, but it got to as high as 88, 90% effectiveness against the UK. Well, what they're seeing with the Delta is after the first shot, that efficacy only ranges in 15 to 20%. Efficacy against hospitalizations at the first dose is about 70%. Efficacy remains high, 95% after the second dose against hospitalization. So what we're seeing is that Delta is transmittable, highly transmittable, contagious. However, when it comes to being vaccinated, that first dose does provide some efficacy. It is only until after your second shot with Pfizer is that efficacy goes up much higher. So it does provide protection. And if you do get the Delta variant, even being vaccinated, your chances of developing severe disease is very, very small. And when I mean severe disease, I mean severe enough to be hospitalized. Your chances are greatly diminished that it will make you that sick to be admitted to the hospital. So bottom line is, if you're going to get vaccinated, do the full first and second shot vaccination, it will be as effective against the Delta or the Indian variant, much as it has been for the UK. So this brings to this table a slight new twist to this, and that really is the, you know what, the Indian variant. It's right here, the B1617 Indian. I left it as unknown, but we now know that its efficacy is as high as 88% with Pfizer. Now, because Pfizer is an mRNA technology, you can almost equate this to being Moderna being quite similar in its data as well. So that's really the only main difference update to this. And next week I'll give an update as to why all these new changed name terminologies are being changed to this. So here in the state of Wisconsin, you know, after talking about all the variants, the B117, that's the UK, the B1351, South African, the 427, 429, that being California, the P1 Brazilian. Wisconsin has gone through all of its sequencing of randomized new COVID cases, and in these sequences, they're looking for not only the original virus, but then we're also seeing what type of variants are occurring in the state. So right now, close to 25, if you get COVID, there's a 25% chance that the infection will be of a variant type. Now, here we see what I highlighted in red here is the variant B117, otherwise known as the UK, also otherwise newly known as Alpha, as the variant. So 18.3% of cases are going to be of the variant type. That's throughout the entire state of Wisconsin. That hasn't changed for over a month now. So it's just one of those points that if you do get sick, whether it's the original virus or of the variant, knowing that you have been vaccinated, if you have been vaccinated, your chances of severe infection dramatically go down, only because of the effectiveness of both Pfizer and Moderna. So these are all, even though the variants are present, it shouldn't be alarming because it has quite effectively been shown to be quite efficacious in preventing infection. What's going on in the world, as I mentioned, we talked about Delta, we talked about India, and right now, India is well on their way to a recovery to its pretty catastrophic spike in cases. They're now under 100,000 a day. That may not seem like a lot, but how they were even a month ago, that was pretty devastating. Here in the United States, that number continues, the number of cases continue to trend downwards. And as the number of vaccines are increasing, we are seeing that the number of new cases here has dropped below 15,000 a day, which is pretty remarkable given how we were just back in November and December. Brazil has maintained kind of the steady flow of infections, kind of slowly finding its way down, 53,000 a day. France, now just so you know, India United States, Brazil, and France are the top 4 countries in the world with the highest number of recorded infections going on right now. So as we look at Brazil, 53,000 a day. France is now at 6,000. If we take a look at some of the other well-known countries such as Israel, now, and the UK, one of the things what I'm seeing in the UK is that the number of new cases has dramatically dropped down. And in fact, they haven't had a case of COVID since June 24th. That's the last recorded case of COVID in Israel was June 24th, and that is now 17 days out. UK kind of has this upward trend, and it quite could possibly be related to the UK, to the India variant Delta that has been noted to be introduced and could be the new concern, the new variant of concern in the UK. So I'm sure more information will come out regarding this, but that is of the latest that I have. Now, one of the things I do is I look kind of between the numbers here in the state of Wisconsin. And this is single dose vaccinations. Wisconsin's currently at 48.7%. The number there to the side, 67,795. That is actually the number of individuals 12 to 15 who have been vaccinated with a single dose. And then to the left is the aggregated total dose, single dose to date by race, by ethnic group. Now, the bottom rows look at the number change, the number of new single dose vaccinations in the past week. Now, what's interesting here is that as of June 9th, yesterday, the native population had a slight increase to 680. The week prior, it actually was down 513. The week before that, it was up, and then it was down. So we have this wave of new wave of new individuals who are getting vaccinated. Now, what's interesting here is that it's not just natives, it's across the board in all ethnic groups, except for our non-Hispanic white population that had a decrease. All other ethnic groups, racial groups have shown a bump increase. Now, I'll show why that may be, and it may not be what you think it is. So the rate to the far right is the rate of change, percent change in the past week. Here we see that 3 groups, natives, Asians, and blacks, actually showed a bump up, while white and Hispanic actually showed a slight bump down. So kind of a mixed bag of elements here that not quite sure what's going on, but I think it's important to notice that the rate of new vaccines in the past week actually took a bump up. Now, this is looking at fully vaccinated 2-dose individuals, showing the rate of fully vaccination by race and ethnic groups. And here to the right half, we see June 9th, all groups actually showed a bump up. So this could definitely be the result of adding the new age group. I think in the next week or two, it will actually tell us maybe a little bit more as to where this trend is going I suspect it may be flat or go down, but we'll see how this all works out. So now, as of today, 5,291,000 doses have been given. Johnson & Johnson, Moderna, Pfizer, all key players in this. And so as of June 9th, there now has been an average of just a little over 16,000 doses on the average every day. So that's actually a bump up. Well, as I mentioned a few slides earlier, is this because of the 12 to 15-year-old age groups, or is this of the adults who are now coming to get their vaccines? Well, May 19th, May 26th, June 2nd, June 9th, I've been following the trends of the 12 to 15-year-olds and what's going on in these age groups, finding out the average. And what I'm seeing is actually a decrease in the 12 to 15-year-old, in the number of 12 to 15-year-olds being vaccinated. So this increase to over 16,000 a day is more of the result of adults now coming forward to get their vaccines. So this is a new trend. This is something new that has been occurring. So now that summer's here, maybe people see that it is, society's opening up, communities are opening up, brewers are going full capacity. Maybe the social events are now on people's minds. They want to travel. Now adults, young and old, are now coming forward to get their vaccines, which is kind of interesting because that's not how the trend was occurring over the last couple of months until today. So that is something new, and hopefully a trend that will continue. Now, what's going on in the United States, what's occurring here, you could probably make the case is a pattern that is occurring in the United States as well. We see the trend lines going down. We see that in mid-May, there was this kind of upward plateau and then started decline. That uptick there for about a week was the eligibility of the 12 to 15-year-olds, and that took a bump up, but then slowly started coming back down. And now when we get to the last couple days here, we see that maybe we're going into another plateau. And this isn't the result of more younger people, 12 to 15-year-olds getting vaccinated. It is now looking at adults. And so, like I mentioned, vacations, summer times here, people are wanting to travel, fly, go places, visit, get back to some new level. But in order to do that and do it more freely, you actually have to really consider being fully vaccinated as part of that discussion, part of that effort to talk about what you're going to be doing this summer. And to tell you the truth, a lot of places are allowing people to have more liberties without mask wearing, as long as you're vaccinated. So that's the sentiment across everywhere is what society is asking. You can take your mask off as long as you're vaccinated. So now I presented this several months in a row now, and really highlighting single dose, fully dose, fully vaccinated. What does that mean? One shot, two shots. This whole idea of herd immunity, this critical threshold, this is going to be coming up and talking more and more and more about, because we're getting close to that July 1, as this current administration has has kind of, insisted on this kind of being that critical moment in time, how we view the current pandemic. Now, as I mentioned, single dose is partial, 2 doses fully vaccinated. When we talk about this, we have to be absolutely clear as to how we discuss and what this actually means. Partial means you still are at risk of getting COVID. Fully vaccinated, your risk of getting COVID dramatically go down. So when we talk about this, when I refer to fully being vaccinated, I am referring to being fully vaccinated. And as July 1 as being this kind of critical point in time, as achieving this threshold, we're looking at probably 48 to 50 million new people, new individuals getting vaccinated. And even that point, we would only be reaching about 62 to 63%. That's still falling short dramatically of that 70% threshold. So even if we did single dose individuals, how many would we need at the rate that we're going right now? 18, 19 million new individuals would equate to about 57% for minimal single dose vaccination individuals. That's still a far cry from this, and it looks like as this trend is ongoing, it may not be until October where we get to that critical threshold of 70%. So things have to occur today, like yesterday, for us to not only get to July 1, but if we're looking at getting to that threshold even before school starts again, let's just say September 1 as that date, the trends would definitely have to change. We would have to start getting back up to maybe 2 million doses a day just to make up for what has been lost to this point. And that goes back to this slide. Look at the trends. We're now down to 823,000 doses a day. This isn't going to do it. And as you can see, the rate of decline continues to decrease and decrease as the days and weeks go by. So it's going to make it even more difficult in stretching that goal line for us to get at even further out, which is concerning because this could then lead into the fall, which leads into next year's flu season. And we start kind of the concern about getting ill. Is that COVID? Is it flu? Is it a cold? Is it something else? I mean, we could be right back where we started from, and fear of COVID start up all over. So looking at the summer, people want to get out, they want to go and socialize. And so this is kind of a quick snapshot look as to, let's say I'm going to Florida, and what's the activity going on there? 13,000 cases a day. Or if I'm going to Texas, maybe I want to go to Houston. Maybe I'm moving to Houston and I want to know what's going on in Texas. Well, 9,500. For people in the Midwest, so let's say you want to go to Illinois, you want to go to Michigan, Minnesota, or even here in Wisconsin, you can see and look at the rate of activity that's going on every day. And we see that, Wisconsin's numbers are pretty low. Michigan and Minnesota are not too far behind. But looking at these numbers, even compared to even 6 months ago, these are dramatically better now than they were 6 months ago. So this is just a quick reminder, again, of letting people know what part of the country they're traveling to and what that risk may be, or at least know what the activity is going on down there, or to the state you're going in, so you know what you're getting into. So I'm going to try to condense this talk today, but I use this slide as a reminder of how responsive the Native community has been here in Milwaukee County. This is a kind of an up-to-date slide on the single and fully vaccinated population here in Milwaukee. This is a slide provided by Offices of Emergency Management. We see on the far left side the white population of having 46% fully vaccinated, Asians 38%, Natives 38%, Hispanics 28%, and then Black community of 22%. So this is really important to know when we start looking at demographics of anywhere. It could be county, could be town, could be state, could be region. What's really helpful, and as this discussion is heavily focused on the Native population, we see that the Natives in this county have been really responsive, and that is a good thing. That's what we want to see. We want to make sure that we can maximize the full effort of preventing COVID in our community. Looking at what's going on in the Bemidji area. So we have Michigan, Minnesota, Wisconsin, the tribes, the number of aggregated confirmed cases to date, and then in parentheses is the number of new infections in the past week. In Michigan, 20 new infections. In Minnesota, 25. In Wisconsin, 13. Now, this is really impressive, and this has been an ongoing trend now for about 4 to 6 weeks of all states and their respective tribal communities. The number of infections are going down. The rate of infection by population, Native population by state, has remained relatively stable. This could be a moment in time where everyone's effort to not only prevent, or either get vaccinated. We're at this point right now where in the next 2 to 4 weeks is going to be really critical to what this may look like come August, September. So the more individuals that we see get vaccinated, these numbers may actually become less and less, which is exactly what we would want to see. That will take a huge effort, continued effort, of getting as many people as we can vaccinated. Now, this is Wisconsin, June 9th. The 7-day average is now 134. We haven't seen a number like this since March 30th. And at that time, it was 124 cases per day. So we are really close to the original start of this pandemic, and it will continue to slide down as long as everyone continues to provide their level of prevention and risk reduction, and that involves vaccines. So unfortunately, the hospitalization rate, the case rates haven't changed for the Native population here in Wisconsin. Here's the hospitalization rate, second in hospitalization in the state. Fatality rate still that first spot for fatalities in the state of Wisconsin. This has not changed in several months. This last slide, and once we do this, I'll get into other, open this up for further discussion. So as I mentioned, the rates of infection are occurring more frequently in the younger population. And so we're talking about the 30-year-olds, 20-year-olds, and the teens, adolescents. That is why at this point in time, it is going to be critical that we look at in assuring that we have the ability and resources to vaccinate the younger population, because as you can see, as you get up in age, the number of infections keep going down. This is not the group that was once so critical and such a priority to address. That has passed, and now we're looking at what is the next priority, and that next priority is looking at the younger population, ensuring they get vaccinated. As I mentioned, we're just finishing school, we're going into the summertime, and if we already start looking at what's to be expected come August and September, all colleges, all universities, all community schools, all secondary higher education institutions are going to probably one after the other start mandating all of their enrolled students now have to be vaccinated before returning to campus. Well, that's higher education. Are we also looking at high schools? Are we looking at middle schools? Are we talking about elementary schools now that you can't come back to school unless you're vaccinated? That's going to be a real hot topic coming over the summer. And my thought is that schools are going to start, more and more universities are going to start mandating that students get vaccinated. Now, there's a story to tell on each side, whether to get vaccinated or not get vaccinated, and whether or not people can mandate you to get it or not. These are all going to be, serious discussions. Now, the main takeaway is looking at the younger population, individuals that do get infected. The younger people tend not to be as sick as the older individuals. And what I mean by that is, even though, let's say, the 10 to 19-year-old group, at least in the past week, has 112 infections, only 8 of those actually required some level of hospitalization. Now, none of those went on to be admitted to the ICU, which is great, and there were 0 fatalities. So this is an ongoing concern and debate as to how we address. I'm being consulted on how to address school activity for the upcoming school year, and knowing these numbers, what advisement and recommendation would I give to schools based on the current data? Well, the current data would suggest that everything that is currently ongoing now, those rates of infections are continually going down. What would happen if you were to introduce or have a more active vaccine campaign for adolescents? Would that dramatically reduce the rate of infections in schools? The answer is obviously yes. So, but how schools operate, again, that is going to be an ongoing debate question. And I know all schools are going to think, the risk of one infection is too many, and so we have to look at reverting back to all of these restrictions and limitations and mandates in schools as we did last school year, and this whole debate is going to start all over again. So these are numbers I wanted to show. I actively follow these, so I have at least a better understanding of statements made to you as to what's going on and what does that mean for you or perhaps a family member of yours, or maybe a brother or sister who has kids that are in elementary school. What does this mean? What's the activity going on for them? I will say once that school is over with, I would suspect that these numbers for 0 to 9, 10 to 19 will drop. These numbers will drop mainly not because they're the vaccines. It's just that they're not in school. They're not in close proximity. It's summertime. School's out. People, are going to be more outdoors. And so we're going to see a number drop here in the next couple of weeks. And that's mainly because elementary and middle school, high school are now out. And then we're going to start seeing perhaps more of the numbers come from the 20, 30, 40-year-olds. And the big question is whether or not that is due to being vaccinated or unvaccinated. And that's going to be the question moving forward, is vaccinations and getting those done. So, Jeremiah, I'm going to turn this back over to you. And if there's any questions, comments, I'd be happy. Oh, there's our buddy. Hey, chum.
Would you, Dr. Ignace? Mark here, everybody. Questions from the community. Hopefully we'll have some people weigh in on the written part. But just sorry about being late. I was in Menominee just about a half an hour ago and just am now getting with you. One of the concerns that I heard from one of the parents is public school is going to make their decisions, that kind of decisions a bit out of their hands. But this is a family with students in a private school and others in public. The older ones are in private school. So the question is, is there a difference when a state or when a healthcare agency like the CDC comes out and says this is what needs to happen? Do they have to go by the same rules? So let's say the state says mandatory vaccination for 12 and above. Does that mean private schools have to do that? Should they do it? If it's on their own, what questions should board members and community members be asking in that private school if it's going to be their decision? And the last part of this complicated question is there a student population that you see needs to be vaccinated? Like, let's say they have some sort of healthcare issue, or not issue, or a challenge. Their immune system that, well, you know what, your school may not be vaccinated, but this person should be if they can be. That kind of profile of students. So those are kind of questions all wrapped up into one. And I'll be listening from there because I do have a couple more. Thank you.
So let's take the student population first. So if we look at individuals who we know who are perhaps at greater risk, not just for being transmittable for the virus, but what could that do for, let's say, a 12-year-old who is newly diagnosed with either type 1 or type 2 diabetes, or maybe that individual that may have an underlying autoimmune or kidney problem, or maybe someone who's had childhood cardiac problems. Without a doubt, these are the individuals that should be first in line to get the vaccine, without a doubt. Now, if we're talking about healthy individuals, healthy kids who've had really no health concerns at all, that certainly is a different discussion. We know that younger, healthy individuals, they could be certainly just as susceptible to the virus as anybody else, but how they exhibit symptoms and signs are much more mild than, let's say, a 50 or 60-year-old, even though they may be healthy. So I'm sure this is run across every parent's mind their kid comes home from school, they have a runny nose, maybe they have a cough, and they don't have full-on fevers, but they look okay, they sound okay, and do they have just a garden variety cold, or do they actually have COVID? I'm sure that's run through every parent's mind. I know it's run through my mind a couple of times with my kids. So, but again, younger people tend to have milder symptoms, and they tend to get over this virus much quicker than older people. So that's where this dilemma comes in, is, nothing's going to happen to my kid based on the numbers, whether or not they should get the vaccine or not. Again, this is one of those questions that every parent has to consider when it comes to vaccines. So now there's so much information about vaccines, and we know how effective they can be. And so should kids be getting vaccines? And, again, that is a question that every parent will have to come to their own conclusion about. When it comes to the CDC and looking at the next school year and whether or not the CDC would come out with some type of mandate, they're not in a position to make mandates. They can provide recommendation and guidance. What ultimately depends is each state is, I guess, view each state as kind of like a sovereign nation. Just like tribes are sovereign nations, they can make their own determination, rules, guidelines, and governance, just like every state can. So states come down with their own guidance and recommendations. Now, when it comes to schools, obviously the state school boards and the individual schools boards all have to kind of fall in line and make their own determination. Private schools are different than public schools, and so that's where the dichotomy starts to occur. And so my sense here is that the boards will try to follow the best advice and guidance that's currently out there, and and perhaps what is recommended for their student population. You're going to get a mixed bag. Every school district is different, from north side, south side, to Whitefish Bay, to Waukesha County. They're going to be different. And even within school districts, their private and public schools are completely different as well. So there's not going to be one message, and every school board is going to will follow that. I think that's clearly been shown up to date now. But I think moving forward, I think the schools that tend to be more of the private, as a private organization or board, I think they will have certainly more liberties into determining what they feel would be best for their student population.
I see that Jeremiah has a kind of a social question. It's related to healthcare, of course. So Jeremiah, if you're there, I know you are. If you could kind of pop on and ask this question, it's really good. Right on, Jeremiah.
Yeah, thanks, Mark. Glad you can make it back. We missed you. It's kind of relative to the education question that Mark posed, and it was just, with universities, or some universities, public and or private, that are mandating vaccines now. If you want to come back in person education in the fall, do you see that as being able to provide a bump in vaccinations, down the road here, or possibly just more resistance to the idea, in that, let's say, 18 to 22-year-old group?
Well, I see a couple things happening. Yeah, there may be more compliance, and that's basically the bottom line here, is compliance towards vaccines, being vaccinated. I also see lawsuits coming too. I'm sure people will feel that their civil liberties are being violated here by mandating, vaccinations to people that perhaps either don't want it or don't believe in it, or for religious reasons. I mean, it's going to be pretty hard for these schools. There are provisions that schools will allow individuals to be present in person. But again, those exemptions are pretty small and few from far between as to why you can be in person but not have to be vaccinated. So I think in the next I think by July 1, schools are going to be, universities and public or private colleges will be making these determinations. And it's really going to force people to have to think harder about whether or not they're going to get the vaccine. And then again, they may transfer. They may transfer themselves to schools that don't have to require this. So there's going to be a lot of shuffling of deck chairs going into the fall. And it could be bad. It could be good things, like the number of people being vaccinated. The bad would be you may see more lawsuits start coming out because of that.
One of the questions we had from a worker in a manufacturing place here in Milwaukee was when companies are going to be, and the idea is that they're going to start asking for vaccination information. What should a worker or a university student be prepared to bring to show that they've been vaccinated? Are we looking at electronic record? Are we looking at something in paper? Is there a order to this, standard operating practice that we need to know about in bringing our vaccination information forward?
Yeah, so I did what I'm sure people have said don't do, but I laminated mine. So that would be probably the quickest way to assure, but believe it or not, let's say in the state of Wisconsin, there's the Wisconsin immunization records. It doesn't take, you may just have to sign a waiver saying that you're giving any institution the right to check on your immunization status, and they'll prove it. You just, if you got it in the state of Wisconsin, they'll say, okay, here, sign this, and we'll check it and we'll verify it. It takes all but 20 seconds to verify someone. So it can be done, and it can be done electronically and pretty quick in response. So each state has these data banks of every individual that has been vaccinated and unvaccinated. We're going to host our third vaccine campaign. It is set for June 22nd. And this is a native only vaccine events. So we're talking about individuals that are enrolled tribal members and household members that or descendants of ages 12 and older. Okay. The vaccine is going to be Pfizer, and we are going to incentivize this event. So we have people who are contributing, who are sponsoring. Creative Health Collective, Bay Bank. We're looking at other Native organizations, Oneida organization here in Milwaukee, as well as ICS, Dry Hooch, GLIC itself. We're looking at food boxes and household items, personal household items, items for children, kids, infants, diapers. We're looking at providing gift cards for both child and adults who receive vaccines that day. We're going to have drawings for prizes for both child and adults who get vaccinated. And one of our huge supporters of this is Wade Fernandez. Many people may know who Wade Fernandez, nominee from Wisconsin, Music Awards, Native Music Awards, very dynamic, very inspirational musical icon in the Native world. He will be here. He'll be playing while this day is occurring. So what's really different about this is that we are being approached by more and more Native organizations to participate, because we all feel the urgency here. We're really at this point of making a dent. And now that school is starting to wind down, school next week is more than likely the last day of school for most kids. I know it here in MPS in Milwaukee, that is. What does that mean? Well, that means summertime. That means family get-togethers. That means cookout, social events, get-togethers. Traveling. People want to travel. People want to get back into their normal. People want to get back to their cultural and traditional activities that they've been so accustomed and used to doing. Well, this is that opportunity. This campaign event, June 22nd, is that effort for the Native community. And I'm not talking about just here in Milwaukee County. I'm talking about wherever this message goes, if it goes to Indianapolis, if it goes to Detroit, if it goes to the UP, if it goes to Duluth, Minneapolis, even St. Paul, Iowa, wherever this message goes, if you're in the area in Milwaukee on June 22nd, come find us, call us. We want you to pre-register. If you're in the area, we'll get you and your children 12 and older vaccinated. Until next time, everyone, stay strong.